Hello, and thanks so much for tuning in today. Have a very interesting case, Failing Fontan. We're going to see how jugular vein flow may show systolic pulsations and how carotid artery flow may show exaggerated early diastolic flow reversal, and see just how easy it is to get great images of the head and neck vessels in obese patients. So this is a very typical asplenia heart. We can see the common atrium and the type C atrioventricular valve. Notice that there are no chordal attachments. This is probably an anatomic right ventricle. These patients typically have common valve, double outlet right ventricle, and pulmonary atresia. But we can also see some movement here, some unusual movement, a little bit of fluttering. So again, this is an 18-year-old male. He's 218 pounds. He comes into the office with tachypnea and tachycardia. So let's see how this valve is doing. Okay, we can see that the jet goes all the way back to the wall of the common atrium. And is hitting that wall, and is probably what that little bit of fluttering was that we saw. This is, again, the type C common valve. No chordal attachments. Have a lot of problems with these valves. So here we can see in color compare very wide base here of this jet, goes all the way back, but we do have some pretty good function still, and overall this heart looks small for someone who weighs 218 pounds. That's a lot of work for this anatomic right ventricle to perfuse all of that mass. So let's have a look subcostal. We can see the spine is here and the aorta is on the wrong side, and this is typical for an asplenia heart. The inferior vena cava is telling us something, though. We can see that it's collapsing with respiration, and that's really unusual. And we look down here at the aorta. It's not very clear, but I'm not seeing a whole lot of pulsation in the abdominal aorta. So let's have another look at this inferior vena cava. So here we can see the inferior vena cava is again collapsing with respiration. The respiratory rate's about 30 breaths per minute. And again, this is very unusual for a Fontan. So this is the inferior vena cava, and here's where the anastomosis is to the artificial conduit, which connects then to the right pulmonary artery. So we're looking at the ascending aorta and looking at the color flow here. And we can see that it's a little bit on the dark side, and the reason is this is a very low cardiac output state, very low stroke volume. The peak velocity is only 0.428 meters per second. It's about half what I would expect in a normal. So this shows a right aortic arch. The innominate artery is here, and it bifurcates into the left carotid and the left subclavian. Usually the innominate artery goes this way. So I've stopped this on the early diastolic frame to show the flow reversal in the carotid. It's very unusual to see flow reversal on color Doppler. And here's the left subclavian, has a little different flow pattern. So let's look at that in real time. So it's very hard to see the flow reversal in real time. But if you look at it closely, I think you can see that just for a second, the flow changes direction. So I'm going to place a pulse Doppler sample volume here and angle correct so I can see the magnitude of this flow reversal. So here's the systolic pulse. In an early diastole, we see this massive amount of flow reversal with a little bit of augmentation during diastole. And in my experience, this is typical of failing hearts, that it's due to the low stroke volume, and there's just not enough volume and blood flow in the aorta to hold the column of blood up, and so it falls backwards. Could be an important sign of left ventricular dysfunction, or in this case, the common ventricle, the single ventricle. So now I'm going to sweep over to the right jugular vein, and I notice I'm seeing some little pulsations here, but the blood flows in the right direction and I'm not seeing any flow reversal. So let's have a look at the pulse Doppler. Again, I'm going to place my sample volume here and correct for the angle, which is typical for vascular studies. So this came as a big surprise. We can see that there are systolic pulsations. It's very difficult to explain. I have no idea how this is happening, but I can see that respiratory augmentation, and it seems that as the patient breathes, he's augmenting his blood flow and the systemic venous return. If anybody has any ideas about these systolic pulsations, please let me know. So using a high frequency probe placed in the suprasternal notch could really improve your echocardiograms, and combining these two methods together is a very powerful way of looking at hemodynamics, and it could improve our understanding of systemic and systemic venous hemodynamics in lots of different forms of congenital heart disease, especially of Fontan. Reverse arterial blood flow and venous systolic pulsations may be recorded by this method. Thank you so much for tuning in.